Hi, my name is Dan. I'm a general neurologist. I'm now working in Paris at the Hopital Lariboisière, but I used to work at the Hospital of Versailles. We've made a collaborative project with the Department of Neurology of the Hospital of Versailles to assess the small vessels in the retina of patients with multiple sclerosis. So, in this study, we've assessed small vessels in the retina of patients with multiple sclerosis using a really high precision imaging for the first time. The idea was that in MS, a part of the progression and neurodegeneration is still unexplained, and the disease is ongoing despite really highly effective immunosuppressive treatment. So, we also know that in MS, the brain has a strong reduced cerebral blood flow, like in many neurodegenerative diseases, but it appears in the beginning of the disease. What we see in MS is that there is a pattern, a pathological pattern, the pattern 3, which is an hypocyclic pattern. We also seen that many lesions tend to accumulate in watershed area of low cerebral blood flow, and then that vascular risk factor contributes importantly to the progression of MS. If we want to study the small vessels of patients with MS, we'll have to do it on pathology. And we know that old patients have impairment of the small vessels. So, we had a new device that's named adaptive optics that has a resolution of 2 micrometers, which is similar to what we can have with microscope. So, we've made a prospective analysis with 20 patients with MS and 20 control. None had a history of optic neuritis, and none have cardiovascular risk factor. So, we assessed several parameters of the vessel of the retina. We assessed the inner diameter of the venule. We assessed the inner diameter of the arteriole, the wall thickness of the arteriole, and a ratio that's named wall-to-lumen ratio. So, wall-to-lumen ratio can only be evaluated using microscope, and it is the most sensitive marker to assess small vessels disease because it recapitulates the 2 phases of arterial disease. The first is vasoconstriction, the second is wall thickening, and when we use both in combination, it makes a really sensitive marker. As you see here, we don't see for the inner diameter of the venule, there is no difference. For the inner arteriolar diameter, there is no difference, and similarly for the wall-to-lumen ratio, there is no anomaly. So, we conclude that our data do not support the existence of a systemic process involving the microcirculation that can affect the course of multiple sclerosis. It doesn't mean that vessels don't contribute to the disease, but our data do not support the existence of this phenomenon in the retina and not as a systemic process. So, I'm really happy to be at this Congress of the European Charcot Foundation. I've learned many things in the clinical area of multiple sclerosis, which is of high value in my daily practice. I've worked in the past on DI in multiple sclerosis because I think it's a really good model to directly see a part of the brain through the eye. In the future, I will probably make other studies on the small vessels, but on vascular disease.